Tuesday, January 24th, and I call the Minnesota Education Finance Committee meeting to order. This morning we have two bills to be heard. But first of all, I'd just like to take a moment and acknowledge that this is National Para Week. The governor signed a proclamation just yesterday acknowledging it. And for those of you who don't know what a para is, it's a paraprofessional. Some people call them educational assistants, EAs. All of our schools could not be as successful as they are without our paras and educational assistants there by the sides of our teachers and the staff in order to do so much of the work that is done and has been done for years and years and years. So as a former teacher, I would like to thank all of my EAs that I have had in the past. And also acknowledge that without those paraprofessionals, our academic success would not be possible. So thank you all very much. And with that, we will begin with our first bill. We have Senate File 56. Senator Hoffman, would you like to make a motion to move Senate File 56 before the committee to lay it over for possible inclusion in a future omnibus bill?
You know, Madam Chair, I miss Education Committee so much. If I was a member of your Education Committee, I would love to move this thing to be laid over for possible inclusion. But I think you might want to ask maybe Senator Gustafson.
There we go.
Since Representative, or wait, he's not wearing a tie, so is he a rep today, or is State Senator Rarick over there?
Thank you so much. Senator Gustafson, would you like to make a motion to move Senate File 56 before the committee to lay it over for possible inclusion in a future omnibus bill?
Yes, I would. Thank you, Madam Chair.
Thank you. All right. Senator Hoffman.
Thank you, Madam Chair and members. And first of all, thank you for recognizing the support personnel that we have in the Para Week, and I appreciate you doing that. You know, as a teacher, I mean, that is really the support that you get in classrooms and even out of the classrooms, and so thank you for recognizing that. And so the other thing too, Madam Chair, is not that we're going to talk about equalization, but if equalization comes up this session in this committee, it would be a good thing to have as well. But in front of you, Madam Chair and members, is Senate File 56, Student Support Personnel Aid. I do have the A3 amendment, which should have been handed out to everybody there. And as you're looking at that, what we did is we took the A1 and the A2 and we combined them. It's kind of like when Public Law 99-457 moved from Part H to Part C. We just combined all the letters into C. So in this case, we combined 1 and 2 equals 3. Here's what it does. Incorporates language from school social workers asking to maintain positions that were hired with temporary ARPA funding, and then, or to move to a partial FTE to a full-time position. It adds back the school nurse position at MDE. It adds the workforce language from last year that this committee worked on, and it incorporates the additional language from school psychologists requesting on that workforce, as well as the requirements of the application to the department that districts list their current roster of FTEs in these specific fields, Madam Chair. So with that is the A3 amendment. Since it is the author's amendment, I would ask for somebody to move that.
Senator McQuaid.
I'll move the author's amendment.
All right. So the author's amendment has been moved. And do you now have the bill in the form that you would like it to be?
Yes, Madam Chair, I do.
All right. Any questions on that amendment? Nope. Seeing none, then we will continue all. Now that the bill is before us as amended, Senator Hoffman, would you please introduce your bill?
Thank you, Madam Chair and members. We know that COVID-19 has affected our students, and their mental health is at a historical low. Those of you that have talked to school board members or had your conversations with local schools know that mental health right now is absolutely critical, and their physical health is also seeing more and more challenges. So in a sense, Madam Chair and members, their day-to-day life has been disrupted. There are school counselors who talk about seeing students as young as 8 with suicidal ideation and school social workers are at their breaking point to meet the students' needs. One needs to just look at the ratio of students to school social workers and to school counselors. And so we've learned, Madam Chair, the importance of mental and physical health over the past few years, but there are several realities that have become clear that our students need more support. It's very clear. Mental health, physical health, and social emotional supports. This bill provides ongoing sustainable funding to every school district and charter school in Minnesota to allow schools to prioritize these supports. Districts would receive the dedicated funding, at least $50,000 to hire a nurse, school counselor, chemical dependency counselor, social worker, and/or a psychologist. Minnesota, as you know, Madam Chair, has 6,000 fewer school counselors, social workers, school nurses, and school psychologists than necessary are to meet the needs of the students. There's a capacity issue there. And we know that student support personnel close that opportunities gap. And school social workers provide children in need with access to transportation, academic support, counseling, basic nutrition, and in some cases, they actually help students find housing. School nurses are often the only, and we know this, the only medical professionals a student will see for months. And nurses educate students on allergies, mental health, hygiene, and emotional regulation. One more caveat in there. If you have a licensed school nurse, you can bill back. So everybody talks about third-party billing. You can bill back, I believe it's at 68% versus 44%. So it actually is a good thing to have financially and for students. School counselors and psychologists provide education on social emotional learning, and they actually see that through what their living experiences are, and through some times in the racial educational lens that needs to be there as well. So there's an understanding. I have so many conversations with my constituents about the need to have more resources in our schools. And for some schools, Madam Chair, that might mean more school nurses to meet that complex medical needs of our students, or wanting a school counselor in every building. Clear, it goes back to the 6,000 number I talked about. And so others might need the supports offered by school social workers or psychologists, and that's why this bill then provides the local control, right? We look at the local control to hire the student support personnel most needed in their community. There's a couple of testifiers with me here today, Madam Chair. Kathy Kamani, I think she's on internets up there. She's the director of St. Paul, at the St. Paul School, she's the director of student support. And then Keila Kylers, I can never get that right. She's the vice president in elementary of the MSCA Government Relations Committee. She's an elementary school counselor in St. Paul. She's going to be in person. And then you have I think a school nurse is going to be here. And then as well as Tahira Shamsubahi, who's a school psychologist, and she's also here from Minneapolis Public Schools. So if you want to go with the testifier on the internets there, Kathy Kimani, that would be all right to you, Madam Chair. So thank you for this introduction.
Thank you, Senator Hoffman. So we have Kathy Kimani coming to us virtually. Would you please introduce yourself for the record, and then you may begin your testimony.
Thank you. Good morning, Madam Chair and committee members. My name is Kathy Kimani. I'm a member of the Minnesota School Social Workers Association, a school social worker, a licensed independent clinical social worker, and I've worked for St. Paul Schools for over 26 years, currently serving as the Director of Student School Supports. My message to this committee is that students cannot learn if their mental and physical needs are unmet. We support, and I'm representing the Minnesota School Social Workers Association here this morning, and we support Senate File 56 because it ensures access to vital resources that will not only support students' physical and mental health, but will also aid educators in their work to ensure the academic success of Minnesota students. At the core of our profession, school social workers understand that people's behavior and actions are both influenced and guided by the context of their environment in which they live. In short, home, school, and community are interconnected. Thus, school social workers dedicate themselves to supporting students and healthy environments. And research has proven that school social work interventions are effective in helping children and adolescents obtain the necessary skills to solve problems, improve peer relations and interpersonal functioning, and ultimately, academic achievement. So this bill invests in school-employed support personnel, like school social workers, nurses, psychologists and counselors, and chemical health counselors. While we are each unique disciplines, together we form an essential team in each school. It's intentional today that we come to you with one voice. This bill will provide essential resources to schools who are struggling to meet the complex and increased student needs we're seeing today. Within the team of school support personnel, school social workers are uniquely positioned to offer mental health support. 40% of school social workers have their clinical license and are qualified mental health professionals. With these resources, school can add additional mental health support, and it is needed. We know prior to the COVID-19 pandemic, research showed 1 in 4 children had been exposed to at least one traumatic event. But since the pandemic, all of us have been impacted by this collective trauma experience. This includes our youngest learners in early childhood, up to our adolescents, to the adults that work in our schools and the community as a whole. Exposures to high level of trauma, especially during a child's early years, may adversely affect a child's sense of security, their attention span, memory, and ability to process information. And this can lead to inconsistent school attendance and poor outcomes all the way into adulthood. School social workers have witnessed firsthand the ongoing impact of this unresolved grief and loss, the persistent anxiety and fears that are overwhelming the capacity of some students' ability to cope and adversely affecting their educational experience. To mitigate the detrimental effects of this ongoing public health crisis, a comprehensive approach is required to address the social, emotional, mental, and physical health needs of students. This comprehensive approach must prioritize access to vital resources, including the school-employed mental health providers such as school social workers. Students across the state of Minnesota, both in urban and rural communities, are not immune to the collective trauma of the pandemic, increased gun or community violence, and racialized tensions. Prior to the pandemic, some students were already struggling with issues like anxiety and depression. But this year, students have required even more support in the classroom to be present and ready to learn. School social workers are reporting increased persistent mental health needs, causing a strain on our current system. Every day, the social, emotional, and mental health needs are apparent, and it shows up in a lot of different ways. It can show up as chronic absenteeism, externalizing behaviors like bullying or physical and verbal aggression, or sometimes internalizing behaviors such as inability to concentrate, debilitating anxiety, and self-destructive acts such as chemical use and truancy. I want you to know that in my role, I regularly consult with school social workers that are spending time providing crisis management services and addressing issues related to suicidal ideation, domestic violence, homelessness, death of loved ones, and situations like that. For example, I hear reports of the increase in suicide risk assessments. Social workers are doing this every week, sometimes engaging in one risk assessment with another student waiting to be assessed. It's important for you to know that too often, even when a high risk is determined and a student goes to a hospital, there is a lack of openings for inpatient services and sometimes even outpatient clinical mental health services. Youth may sit in the ER for days and are released and return to school the next day, where we welcome them and do our best to create a safety plan and get them back into the school routine. School social workers, along with our school support personnel colleagues are filling in the gap.
That's at St. Paul Broadband.
And to end my testimony by acknowledging the amazing resilience that I witness in students and families and my educator colleagues every day. I have shared with you the truth and the picture that schools are struggling in the aftermath of a pandemic, yet I am not hopeless. I believe with comprehensive support, we will recover, and I want you to know that school social workers work from a strength-based perspective, and we continue to see the greatness in every student and want to work collaboratively with our school colleagues, families, and community to support every student to address the barriers to learning. Senate File 56 offers two key components. One, an investment in school-employed student support personnel that allows funding to be used for new full-time positions, moving part to full-time positions, and ensures that positions funded by the American Rescue Plan funds are sustained after that funding stream comes to an end. The second component addresses workforce shortages that impact all of our professions. MISWA is recommending that language related to workforce needs is more comprehensive, universal, and includes the shortages facing all of our professions. Our hope is that trying to develop workforce language will not slow down the important progress of this bill. Investing now in our children, schools, and mental health workforce is an investment in their healing, recovery, and ability to learn. Again, students cannot learn if their mental health and physical health needs are unmet. Thank you for your time today.
Thank you so much, Ms. Kimani, and your expertise in this area and advocating for those students. Next, we have Keela Coolers, and she is at the podium. If you would please state your name, begin your testimony, and hopefully you have signed in on the form up there. Thank you. You may proceed.
Madam Chair, members, my name is Keela Coolers. You will never meet a cooler counselor, Senator Hoffman.
I got that. Cooler.
Could you speak a little bit closer to the microphone? Thank
You'll
you.
never meet a cooler
Cooler counselor, I like that.
Okay. I am the 2022 Minnesota School Counselor of the Year and Vice President of Minnesota School Counselor Association. I've been a school counselor for 12 years, primarily in urban K-5 elementary schools. Today, I hope to expand your understanding of how essential elementary school counselors are in a complete equation of student mental health and support as you consider Senate File Bill 56. To be right to the point, the majority of elementary schools in Minnesota do not have school counselors. This is not a condition isolated to just rural areas of Minnesota. It is throughout our state. The equation of response to student mental health in most schools is with social workers, school psychologists, behavior intervention staff, sometimes with limited training or formal education about mental health, or they just contract with outside community therapeutic agencies. Those roles are seen as equally interchangeable, and if one of those roles is filled, there's an erroneous assumption that the mental health support box is checked, but it isn't, and that equation is absolutely incomplete for the needs of Minnesota students. Some of those roles just carry a caseload of students who are referred by a teacher or guardian after there's an identified concern, or some just respond in moments of crisis. They are vital in the school community, but it is still incomplete. While elementary school counselors provide those services, we do work in schools that are markedly different than those aforementioned roles that focuses on preventative skill building for all students. One of the significant ways I will highlight where elementary school counselors are uniquely different is that we proactively teach classroom lessons. At my school, we are in front of over 500 students, all of our students, every single week. In fact, about a third of my time is spent teaching in the classroom. I cover a wide scope of topics from emotion identification and management, bully prevention, conflict resolution, career and college exploration, peer pressure, accepting differences. We build personal learning plans, and the result of students who are equipped with strategies to understand and manage their mental health and have skills to build healthy relationships with those around them means they're better able to focus on their education and take on learning challenges. And while I genuinely love my job and the ability to work with so many young brains every day, challenges are a part of the package. Simply put, the current state of student needs are just so great. Every day, I am placed in positions of having to prioritize work on multiple situations that all need vastly more time that's available in the day. In the continual shockwaves since the COVID pandemic, I've completed more self-harm risk assessments with students in the past 2 years than in any previous school year in my career. The volume of students I see for significant anxiety struggles and engaging in high-risk behaviors has grown exponentially. I game plan how to inhale my lunch in a few minutes so I can squeeze in one more student in the day, or strategize ways to fit in one more phone call or make one more referral before I leave. And I know my state colleagues across all levels share in that sentiment, contributing to high levels of burnout and compassion fatigue. Our National School Counseling Association has best practice recommendations of 1 counselor to every 250 students. Minnesota in 2021 was over double that, averaging 1 to 592 students. We are the 4th worst in the nation, and we are significantly behind our neighbors. For example, Wisconsin has 1 school counselor in every school building, and in their state, they have a school counselor in every school building in their state, and they have school counselor representation at their state education department. Iowa has a required 1 to 350 ratio, and North Dakota is 1 to every 250 students. I hope you see from my testimony today with the unique preventative work that school counselors bring when they are part of the comprehensive equation to support student mental health. Kids are empowered with tools to recognize and respond to their emotions in a safe and healthy way. They are better equipped with the needed mindsets and behaviors to take on learning challenges, and they are more confident in themselves as learners. Minnesota students deserve access to a school counselor from the start of their education. I genuinely thank you for your time today and consideration of moving forward with this bill, Senate File 56.
Thank you so much, Ms. Coolers. I appreciate the work that you've done, and congratulations on your position as a leader in this field. Thank you so much. Next, we have Tahira Shamsul Bahari Cobb, who is a school psychologist for Minneapolis Public Schools. Would you please state your name for the records, and you may begin.
Good morning, Madam Chair and members of the Committee of Education and Finance. My name is Tahira Shamsul Bahari Cobb. I am an early career school psychologist, and I'm grateful for the opportunity to testify today. I work for Minneapolis Public Schools, and I want to preface by saying I do not speak for all school psychologists within education, but rather sharing my experiences within an intersectional lens. In my day-to-day as a school psychologist, I conduct psychological evaluations and gather data to determine eligibility for special education. We support students' individual education programs, working with multidisciplinary teams. School psychologists have special knowledge about adaptive behaviors that predict student success. Therefore, we teach and enforce pro-social behaviors that help students do their best. We develop intervention plans for teachers and staff, meet with parents and community supports, and depending on the unique needs of a school psychologist may host trainings to help parents and school personnel address common issues impacting students, such as bullying. We are also knowledgeable in specific research-based frameworks and theories that are known to support our most vulnerable students and families, known as multi-tiered systems of support, or MTSS. So at the core of it all, we comb through and disaggregate data as a standard practice to address students' academic, social, and mental health needs. So as you can see, our school psych training is expansive, and we have the ability to create structures and systems to respond to our students' needs in equitable and inclusive ways. However, with the growing mental health needs of our school community, lack of resources, and the lack of student support personnel to support core curriculum standards, I am pulled away from doing my job as a school psychologist, and I'm unable to engage in the work that I'm passionate about. Instead, much of my day is spent responding to our students and staff who are in crisis. I'm constantly having conversations with parents about ways to support their children, and I'm left with the dread of telling them that our school-based mental health clinics are full, we're booked, or we can maybe meet about your student the following week. In November of last year, I had a family reach out to me in desperate need. Their child was experiencing severe mental health challenges, and they had been on a wait list to see a therapist or to get into a clinic since August. To try to explore all their options, they contacted me to see if we had any mental health supports to offer. Unfortunately, I had to tell the parents that we too have a wait list, also meaning I had no resources or solutions. This is not an isolated incident. This has been an issue since I began my career. The tricky aspect about mental health crises is that they don't have a timeline. They don't have the luxury of conveniently waiting until we're able to respond because we have a wait list of students we need to connect with, hospital beds are filled, or in-treatment facilities are at capacity. Schools, more than ever, have become the primary access point for mental health care and are at times the only option for our families. It's imperative that the related staffing ratio reflect our increasing demand of children's mental health and academic needs. We need support at the legislative level now more than ever. We need support from those we elect to represent us, to advocate for a consistent, meaningful, and dedicated revenue stream for student mental health to combat this national emergency. We cannot move forward without addressing our student support shortages in Minnesota. We must hire more school social workers, school counselors, school nurses, and school psychologists. And we need to collaborate with our representatives and inform those who are positioned to make these important changes in policies within education. And only then can we move forward. We can move from performative to intentional efforts to ensure a brighter future for our youth. Thank you.
Thank you so much for your words and the work that you do, Ms. Shamsu Bahari Kab. I appreciate the work that you do. Senator Hoffman, do you have any more testifiers?
Madam Chair and members, no, the nurses were here. I mean, if you want to hear from Cap O'Rourke, you can, but I think these, what you heard, these three were very compelling, and there's another piece that I think is important, has a finance chair, Madam Chair, that the services that these individuals provide are billable services. And so as you look at the services that they are providing in the schools, it's 100% reimbursable. Psychologists, it's not just you're throwing money on the table, we're actually getting a billable service in a much needed area. And the same thing, Madam Chair, you'll probably see a bill in front of you that will allow our school social workers to also do billable services, which it's how it should be. I just assumed that's how it was always there. But that's really compelling for you to know as the finance chair. And also, Madam Chair, there's some additional handouts that everybody has either in front of them that you had put in there, which was school counselors matter, the school counselor to student ratio, which of course is cooler. I love it. That's the best way to, I'll never forget that. It has do it out, and then school counselors matter, PDF. But with that, Madam Chair, that's the bill and the testifiers, and I would hope that you can support this all the way through the end. So thank you very much.
Sure. Senator, I have a question. When you say billable, would you explain for our members and the audience that are listening, what does that mean to be billable?
So CFR 34-300.123 says that if you want to look it up, you can, but no, I'm being funny, Madam Chair. When you're doing special education or related service or any medical related services in school districts, which you do, right, then you can bill third party. You can do as a billable service. And in the case of, I'm going to spend as a school psychologist here, you will spend probably 70 to 80 full-fledged assessments on a child in the school to determine their eligibility for special education and or related services. And those related services, those things are billable when it's medically related, when it's something in the case of a psychologist, the logging in, the assessment, everything they're doing from a Woodcock-Johnson to a Wishler to whatever the test that they're doing, that is a billable service just like any other kind of clinical-based service would be. But in this case, you would bill the Medicaid and get reimbursed for that. So it's levels out that playing field, Madam Chair. Did that explain what you needed?
Yep, so with, if they are able to bill those hours and the time out to like Medicaid, then Medicaid reimburses the school district.
Correct, Madam Chair.
Okay.
Thank you, Madam Chair. And that is, you hear the conversation, everybody says it's crass subsidy. Well, I'm tired of that because the fact is every student in Minnesota is a general ed student, right? There's some students that have unique and special individualized needs. And in order to cover that, you can be able to bill for those services. So hence we go back to, we need those medically related services. And I started at the beginning, and now I remember, a licensed school nurse bills at a higher rate toward Medicaid than just a registered nurse does in a school district. So it benefits schools to have that licensed school nurse in there because they can actually recoup the costs that they're doing in order to do the services that are provided.
So would they be able to bill to the family insurance as well, or is it just Medicaid?
So some parts you can, if it's, but here again, there's a gap in private. There's a gap in private insurance on those billable sides, Madam Chair, and maybe that's something we want to look where it's just not just the Medicaid billable, because it's the Medicaid rate that the school psychologist gets, but rather why aren't we also billing those to third party, which in the case, I wish it was 100% consistent. And if it is currently that way, I don't know. I haven't served on education for many, many years, but when I was, that was not necessarily the case. So there's a gap there, Madam Chair.
Thank you, Senator Hoffman. Senator Rarick, you had a question?
Thank you, Madam Chair. And I think some of your questions are getting at some of the things that we talk about. It sure sounds like there's a lot of paperwork and applications. And I see in your bill also subdivision 3, you're asking that the schools, they're going to have to apply for eligibility with the agency. Can you help us understand what the process is going to be for schools to go through that to become eligible and get this aid?
Senator Hoffman.
Madam Chair and Senator Eric, I don't know the process. I can get somebody here that can get into the weeds on you about the process and what it takes. Members, do you have an idea of the process that's involved in filling that out? I got somebody who can got through the process for you. So, Caitlin.
Welcome to the committee, Ms. Snyder. Would you please state your full name and you will begin your response?
Good morning, Madam Chair and members of the committee. My name is Caitlin Snyder. I represent Education Minnesota. Members, this language was picked up from, I believe, last year's or 2 years ago's governor's recommendation in this area. So I believe that MDE has outlined a process for what this would look like and to ensure that these funds are going to the legislative intent.
Thank you, Ms. Snyder. Follow-up, Senator Rarick?
Thank you, Madam Chair. I think the follow-up will mostly be a statement. I think one of the things we're looking at that my caucus is wanting to prioritize is not putting more burdens and paperwork on school districts. And I think this is a great example. I think we all appreciate the work that's being done and support the work that's being done. But instead of asking our school districts to have to apply for something new, if we can tackle the special education cross-subsidy and even money on the formula, that frees up general fund dollars for our school boards to be able to make these decisions without having to go through a whole nother process. So I just want us to keep that in mind as we're looking at what our final bill is going to be. Instead of creating new things for schools to have to do, let's see what we can do to help them out to free up their money. I know Senator Hoffman spoke about local control on this, but I think maybe some schools are already doing well in this area and others are not. And if a school district has other needs that they see, I think we need to give them that flexibility to do what they see as their highest priority without increasing a bunch of work that they have to do to get more student aid. Thank you.
Thank you, Senator Rarick. And any response, Senator Hoffman?
Yeah, Madam Chair, and thank you for clarifying your point on the process. Absolutely, paperwork. I'll never forget one special education teacher who was doing transitions. She had a stack, Senator Rarick, it was this big, right? And she said to me, if it wasn't for these kids, I could get my paperwork done, right? And that was a tongue-in-cheek statement, but when you looked at the due process, and this is where maybe you guys could start, maybe the policy people can really look at, what are the due process stuff that's here that's going to guarantee the constitutional right? Because, again, going back to the fact a student is a student, right? It is a constitutional right to have a child, to have free, appropriate public education, FAPE, right? It was a lawsuits, and if you want to get educated about what lawsuits started in Pennsylvania and ARC and Mills versus DC, all the way to Tatro versus Texas, I'll go all day on that. But your point is that stack of papers needs to get shrunk down. And so the process thing I think that Senator Rarick is raising really makes a point. Is like how much then time as a school psychologist you're spending gobs of time. If anybody want to take a Woodcock-Johnson test, that's got to be 60 hours just in and of itself, right? I mean, just to fill that stuff out. So I don't know how you as a committee kind of rethink or relook at what I believe when Eric Pratt or Chuck Uyghur were chairs, they started to look at paperwork reduction. But let me be very clear, you don't want to deny somebody's access to free appropriate public education, FAPE. That is a due process right? But you do want to get rid of that redundancy and that extra paperwork. So to the point that Senator Rarick did, I think it's valid that you guys talk about that. So.
Thank you, Senator Hoffman. Senator Cwodzinski, you had a comment?
Not a question, a couple comments. Thank you, Senator. First of all, I wish my last name had a cool way to introduce myself like yours. I don't know how I can weave Cwodzinski into the conversation, but very clever. I'm sure you've used that a few times. Hopefully your office doesn't reflect that temperature. So, thank you, all three testifiers. Senator Hoffman, I just can't thank you enough for this bill. Our kids are hurting. We know it. I know, like, when I was a kid growing up, soldiers came home from Vietnam with post-traumatic stress, and now our kids are coming home from school with post-traumatic stress. That's unacceptable. We as a nation, this is a crisis of World War proportions, sincerely. And if we don't take this on nationally, we can certainly do it in the wonderful state of Minnesota, because our kids are hurting. And last spring, or maybe it was last week, I can't remember now, but I went to the counseling department in one of the high schools, and I met with the counselors, and they talked about paperwork reduction and the amount of paperwork, and they talked about the last time they had a duty-free lunch because they hadn't had one in years. And then I listened to them, and they said they don't counsel anymore. All they really do is react from one crisis to the other. And the social worker, I asked the social worker about suicidal ideations, and he said they're through the roof, quote unquote. And so I applaud that two of the three testifiers brought that up in their testimony. And, you know, being 46 in the nation is just not okay. We're the education state. We love our kids. Not that other states don't love their kids as much as we do, but we take care of our kids. And when our kids are hurting, and I just don't, and when I asked the social worker about suicidal ideations, he said it's a 1 to 2 month wait to see a therapist. A 1 to 2 month wait, and there's a lot of people nodding their heads out there right now. That's insane. These kids they don't have the luxury of a 1 to 2 month wait. And so thank you for introducing this bill. I don't really know what else to say other than I think the silver lining of COVID, if there is such a line, it's that we, and all of you testified to this, it's that we are starting to realize there's more to our youth than just academics, and that there's spiritual and physical and mental and social needs we've been neglecting. And I think that's what is reawoken in Minnesota and the nation. So thank you, Senator Hoffman. I really was expecting more numbers and statutes and public laws citing. You only did one, so thanks.
Let's not encourage that too much, Senator Cwodzinski. Senator Mayquade, you had a comment?
Thank you, Madam Chair, and I'm going to make it really brief. Senator Hoffman, thank you so much for bringing this. And I really want to highlight what has been shared with us today. Imagine if our students were at school with broken arms, and they went in and they said, hey, my arm is broken. And they're like, great, we can see you in 2 months. Come back. Just let it dangle there. It's going to hurt. It's going to be really painful. It might heal wrong, but we'll see you in 2 months. I mean, this is a really basic thing that we need to do for our young people. We know that they're in emergency rooms because there's no place for them to go to get help. And so this is a really, really good place to start for us to make sure that we can start healing some folks in Minnesota. So thank you for bringing this bill.
Thank you, Senator Mayquade. Any last words, any comments? Now we have Senator Farnsworth. Would you like to make a comment?
Thank you, Madam Chair. Thank you, Senator. And I do want to point out that I, in my previous life, did administer between 130 and 150 Woodcock-Johnson tests of achievement every year as the special ed evaluator. So it's an interesting it's an interesting situation. I just wanted to brag, that's why I brought that up. But a couple of things that I want to point out. First of all, we've talked a lot about the cross-subsidy, and I know, at least in the districts that I've been involved in, school psychologists are paid under the special education formula. And so this wouldn't necessarily help to alleviate that problem. You know, helping to address the cross-subsidy would do that. School counselors, at least in my district, were 50% paid out of special ed. So again, this would sort of help that. But I kind of want to echo Senator Rarick's comments that if we address the cross-subsidy, that's going to free up a ton of money for districts across the state. One of my big concerns about, we need it. One of my best friends is the school is a school counselor, and he's the one that's on speed dial if my water heater, you know, breaks down and I have to call somebody to fix it. He's the one that I call, so he'll be upset if I don't support school counselors and I might, you know, my wife might not have hot water. We need this. We know that we need this, but the other thing we need is flexibility. And quite frankly, Minnesota's education system is the least flexible. You know, whether you look at the limitations that are put on how we spend money, whether you look at teacher licensure, whether you look at the grad standards. And I don't think that we need to put one more layer on our schools and say, well, you have to apply for this money. I would prefer to say, we're just going to put it on the cross subsidy, or we're going to put it on the formula. Because again, I've said this in previous weeks, different schools have different needs. Some schools might not need school psychologists. They might be okay there, but they might need more counselors. Or they might need a math teacher. And so I think we need to give schools more flexibility. I think everybody here recognizes that this is a need, and we have an opportunity to do something really good, really bipartisan, because I think everybody in this horseshoe wants to help schools, wants to make sure we address the cross subsidy, wants to make sure we add money to the general formula. The concern again is paperwork. In my district, we do have a special ed secretary, but she's so overworked with the billing. You talked about, billing Medicaid. And so they started to have special ed teachers submit some of that paperwork because she couldn't keep up. So not only is it adding more paperwork to her, and can't afford, they can't afford to hire somebody else, because they're already spending so much in the cross subsidy, but it's adding more work to the special ed teachers to fill out that paperwork that would get billed then to insurance or to Medicaid. So I think this is something that we need to do, something that we need to address, but I think there should be a simpler way to do it that doesn't add paperwork and more layers of bureaucracy. So those are my comments. Thank you.
Thank you, Senator Farnsworth. We always appreciate your insight, and thank you for spending so much time on those assessments that can be pretty grueling. Thank you. Senator Kroon, you had a question or a comment.
Thank you, Madam Chair. I'll try to be brief because Senator Farnsworth stole a lot about what I was going to touch on. But, I understand the need for mental health services in our school. Being on the school board, I've seen it firsthand. I've heard about it from parents. I think we all agree that there is a need for this. And typically, we operate in a world with finite resources, and maybe we're not in that world anymore. I don't know. Or maybe we will be further down in the process, and maybe my questions will be more relevant at that point. I don't know. But again, my comments will go to the special education cross subsidy, and there's been a lot of talk in this committee about reducing or eliminating the special education cross subsidy. And what I really like about that idea is that it offers maximum flexibility to our school districts. Every dollar that goes towards a cross subsidy frees up a dollar from the general fund for that district to use for its specific needs in their district. And one of those needs that I've heard most often is mental health services. And so when we talk about eliminating the special education cross subsidy, there's a component to that in my mind, that addresses mental health needs in our schools. So I guess my question is there an overall sense out there that if we did free up funds in the general fund, when we tackle the cross subsidy, would there be districts that simply would not use those freed up funds to address their mental health services need in their district?
Thank you. Senator Hoffman.
Thank you, Madam Chair, and Senator Cruin. So let's unpackage this. 1974, the CDC came after there was a Mills versus DC decision, right? And that Mills versus DC said it was it was a undeniable, it was a fundamental right to free appropriate public education. It took what the ARC of Pennsylvania, when the ARC went against the state of Pennsylvania regarding free appropriate public education, it was about kids with disabilities have a right to go to school, right? This became a fundamental right. Supreme Court said, yep, you're right on that. And then they also said, it's a funding issue. You can ask anybody who's an expert in this world, right? And I'm absolutely accurate in this. So then Public Law 94-142 was established that said, then we're going to put this into place. And they asked the CDC and the National Institutes of Health, because at the time it was most of your kids and people, we actually had people in disabilities that were in state institutions, believe it or not, right? And we didn't treat them very well. We didn't give them free appropriate public education. We didn't pay for their health care needs. We actually, when they died, we buried them in a plot that had a number, it didn't have their name on it. So if you want to look up Remembering with Dignity in Minnesota, it's there. Minnesota was ahead of the curve, yet at the same time, the federal government said, okay, we're going to bring these kids back from state institutions, right? And they operated like just south of us in Iowa. It was called the Smouse School, right? In Des Moines, there was a segregated school. It was the Smouse, and that's where the kids lived too. That's what they called it, Smouse School. I don't know why I remember that, but I do. But you're tapping into something that I spent my life working on. The CDC and the NIH said in a question, how much is it going to cost to educate an individual that's in a state institution back in the community? And they used the term mainstream. I hate that word mainstream because you don't mainstream anybody because it's a fundamental civil right, right? And so they said it would be 40%. It's a number they threw out there, right? 40%. But there was a comment then too. It was a trifecta, right? Local, state, and feds all had an obligation. Federal had an obligation, state had an obligation, and the local community had an obligation to pay for and educate children with disabilities, right? So if you look at that, and you hear about the cross-subsidy, and let me just caution you on the way we use cross-subsidy, and I did some time, I didn't do as much time on the school board as Glenn Gruenhagen did, but I did enough time on the school board. That is funny, Jason. And so the thing there is, when you look at that, you start to say, well, we're taking general fund money to pay for something that's a constitutional and a civil right is a wrong argument. The real argument is we are underfunding education, period, in the state of Minnesota, right? And what that number amount is X. So the other thing that comes into play too, and you guys are gonna have to deal with, is a lot of times in education dollars, and you know this as a school board member, there are strings attached, right? So it's categorical this, categorical that, categorical. And at the time of Public Law 94-142, there was categorical disabilities that were part of the funding stream, right? Nobody knew at the time that autism and mental health would all of a sudden, poof, go through the roof on things, right? And it was also at the time too, hence the argument, specific learning disability, SLD, which is a categorical disability, right? Some people weren't seeing as somebody who's that has dyslexia. It actually is a specific learning disability. At Minnesota, there was some clarification that we had spent years on. So in this case now, let's clarify, what those supports and services look like in a school district. And we know factoid, right, that we're underfunding and we're undermining the school psychologists because of the needs there and the school counselors because the absolute need is there well, right? Going back to Senator Farnsworth's point, it's a billable service because of the fact that you can bill Medicaid for those services. I think the more you enhance that, and I'll give you a prime example. When I joined the Anoka-Hennepin School Board, I said it twice now, and I promised Steve Cwodzinski I wouldn't say what school district I served on, but when I joined that, we were only billing, third-party billing, at $10,000 per year, right? After we had started saying, well, wait a minute, and the argument was, well, it's going to take too much paperwork to fill out all that paperwork to bill. Now they're billing like $3 million, so they're recouping $3 million a year. It's probably higher than that now. Somebody will probably correct me, which is fine, but I know it's north of that. But it's paying for somebody to do all that paperwork, both on the health side and on the district side. Hence, coming back to your appointment about due process, right? Paperwork exists because of lawsuits. Due process, the only why we have free appropriate public education is because of a lawsuit. The only reason why we're sitting here having a conversation about free appropriate public education is because somebody wasn't guaranteed that right, right? And so hence due process. You ask any attorney, he'll say, well, we got to have this due process. But then it comes down to the local control. You have which paperwork did the state require you to do, which paperwork did the feds require you to do, and which paperwork now are individual school districts requiring you to do, and there's a difference along the board. And I know I went down the rabbit hole, Senator Cruin. It's just, I absolutely missed this committee, and I would love to be part of it, but I'm not. And so, I mean, thank you for asking those questions, and thank you for challenging the system to say we can do better. But to the point, we just underfund education, period, in the state of Minnesota. That's the argument going forward. So, does that make sense?
Follow up?
Yeah, thanks. And I'm not quarreling with the fact that we underfund education, period. That's not the point that I'm quarreling with. It's a question of when we add those funds, the best way to do that. I guess that's what I'm trying to get at. And I guess it's more of a philosophical thing. And the question wasn't meant to be adversarial at all, because I'm really trying to figure this out. The best way to go about when we increase the funding to education like we're going to do in this session, should that come in a new program that does have new requirements and new strings and new paperwork. And maybe that is something we want to do if we don't believe that addressing, say, the special education cross subsidy and the dollars that frees up isn't going to solve this problem in your bill. And I'm just trying to get at whether or not we have a sense of, if money's freed up in other areas, whether it will go to this locally or whether we don't think it will. I guess that's kind of where my question was. But
Thank you, Mr. Cruin. Senator Rarick, you wanted to do a quick follow-up, and then we have Senator Gustafson, and then we have Senator Wickland.
Yeah, thank you, Madam Chair. And I think we got a little taste of Senator Hoffman's, he does such a great job of bringing in all these court cases and all these obscure details and facts. And I couldn't help but notice that he said, on this one, I'm being absolutely accurate. Senator Hoffman, are you admitting then in other cases you're not always accurate?
Touches. Any response to that, Senator Hoffman?
Madam Chair, thank you, Senator Rarick. I absolutely, yes, I appreciate that. Was good. You got me. I will mark that one up on the book. That was good.
Thank you. All right, Senator Gustafson.
I guess thank you, Madam Chair. I've kind of forgotten half of my questions, but I'll try to remember them now. Up until last month, I was a teacher. I've been a teacher for over 10 years, and everybody is really struggling. I know that I have just got done talking to counselors at Centennial High School, and they are hanging on by a thread. I talked to administration from White Bear Lake High School last week, and chemical abuse, mental health is all on the rise. And teachers, quite frankly, in the classrooms are not equipped to deal with this. But the bill here is, right, this would put professionals in the schools that would actually help with those things, and that in turn would help teachers and most importantly would help students. I just want to make sure that I have this right. I talked about this all summer long. And I promised people that as somebody who is a teacher practicing currently in schools up until last month, I know what is probably hurting them the most, right? I have that firsthand experience. I really like this bill because I think it addresses some of the things that the teachers are seeing right now. But I had a couple of questions. One, the initial aid will be made available to public school districts. So that's $50,000 per district. Is that correct?
Madam Chair,
Senator Hoffman.
That's correct.
Okay.
Senator Gustafson.
Thank you, Madam Chair. And I think that is a really good thing, because that puts money directly into places that it's needed. And I think that's a good starting spot. I wanted to go back to, and I'm sorry, one of Senator Farnsworth, maybe somebody, sorry, mentioned something about local control. But I think I wanted to point out, too, that this does give schools options and some local control. So, Senator Hoffman, it says, if a school district does not receive at least 2 applications and is not able to hire a student support professional, then the aid may be used for contracted services from individuals licensed to serve. So then they can choose like a counselor, a psychologist, social worker, nurse, chemical dependency counselor. Is that accurate? That must be part of the local control you were talking about. Is that correct?
Senator Hoffman.
Madam Chair and Senator Gustafson, yeah, you're looking at Section C, just before Subdivision 6. That is correct.
Thank you. Any follow-up?
No, I just wanted to say thank you so much. I think that this is a bill that will actually help, students immediately in a place that is necessary. And I also want to point out that there were a lot of years, so I can think of the last 4, where I don't remember hearing a lot of emphasis about the special ed cross-subsidy. I'm happy we're hearing it now. I think we had a lot of years in the past where that could have been a focus, and we could have been putting more money into the subsidy, which would have given more funds to general funds and fixed a lot of these problems. I'm glad it's happening now. I wish it would have happened earlier, but again, bills like this are going to make a difference in our schools. So thank you very much.
Thank you, Senator Gustafson. And Senator Wickland.
Westland.
I'm sorry.
You know, we W's, we all look alike, right?
Senator Westland, my apologies.
Thank you, Madam Chair and Senator Hoffman. Just to kind of get down to the nugget, and I think to go a bit to Senator Cruin's question, so I'm clear because I'm new to all this. We may, let's say all the stars align and we fully fund special ed, and that does free up money in the general fund. The whole point of it being a general fund is it can then be used for anything. My understanding about your bill is it's saying that the funds that are allocated absolutely have to be used for this purpose. So they don't just go into the pot to be distributed elsewhere. My understanding is this is saying these funds must be used for this purpose. Is that correct?
Madam Chair.
Senator Hoffman.
Thank you, Madam Chair and Senator. Yes, and it also, it helps you focus on a pipeline because we know that there's been that deep need, right? Hence, you see all the reports that are there, and hence what our school district's saying. So this addresses a huge gap. And on top of that, that person, if they're a licensed professional, then gets to bill back their time on third-party billing. So it helps offset some of those other funding costs, which frees up more money to be able to do their work that they need to do. So it's a great question.
Thank you. Follow up, Senator Westland now? No? Okay, folks, we are going to move on to our next bill. I want to thank you, those that testified today on this incredibly important. I think we could sit here all day and talk about this, but I think it's one good step in the right direction. So thank you so much for coming to the Capitol today and sharing your experiences and advocating for our students.
Madam Chair. Madam Chair.
Senator Mayquade.
Is this being laid over for possible inclusion?
Oh, yeah, we have Senator Hoffman. Would you like to sit down and we'll finish up? I was just going through the thank yous. All right, so.
I'm sorry, Madam Chair, but you're Vice
any
Chair.
brief comments at the end? Brief comments. No comments to be said. Okay, so Senator, I believe it was Gustafson, renews her motion to lay over Senate File 56 for possible inclusion in our future omnibus bill. Thank you. All right, next.
Madam Chair and members, thank you.
Yes, you're welcome. All right, next we are going to move on to Senate File 50. Senator Cwodzinski, would you like to make a motion to move Senate File 50 before the committee to lay it? Oh, it's not moving on. Is it moving on? Yeah, to be laid over to, or moved to finance.
And I offer the A8 amendment as well, Madam Chair.
Okay, so you have an author's amendment and you just, excuse me, would you like to move your A1 author's amendment to be before the committee to put the bill in the shape that you desire? And you have, okay. So now the A1 is before us. Senator Cwodzinski, would you please tell us about your amendment?
Yeah, thank you, Madam Chair. You know, the previous testifiers used words like trauma in their testimony. Trauma, anxiety, depression, social emotional needs, chronic absenteeism, and the final testifier mentioned the first one actually mentioned the words mental health and physical needs. the mental health and physical needs. I couldn't have planned a better segue into my bill than the previous testifiers and Senator Hoffman's bill. My menstrual equity bill, Eden Prairie High School in my district last year did a survey of all the students, and they asked them what issues are important to you, and they got 329 responses from the students, and number 7 in all those responses was free menstrual products. And the state fair actually added that question in their scientific survey that they conduct every year at the state fair. And out of 12 questions, the highest answer yes was abolishing the Social Security tax, and right behind it by a point or two was providing free menstrual products for our students in our schools. And so, you know, I've talked to counselors and nurses and social workers and teachers, and this idea, it's classic how a bill becomes a law 101, because this bill was brought to me by students 3 years ago now at a high school in, actually Hopkins High School, and they brought it to my attention, and they said to me, young women should not be punished for being young women. And that, and it might have been one of these two, but last week in policy, it has really resonated with me what one of the young women said last week, that not having menstrual products provided turns a normal day into a traumatic one. And I'm not sure who said it last week, but the fear and shame and embarrassment because a machine requires a 25-cent fee in order to have what for men is just toilet paper and soap and paper towels that we don't think twice about. For $2 a student, $2 a student, we can help our female students out there with the trauma and anxiety and depression and social emotional needs and the chronic absenteeism and having them have mental health and physical needs be met. And with that said, I've got a series of testifiers, and I'm really anxious. Now, if you guys are half as good as the testifiers we had last week in policy, we're in for a treat and some heart-wrenching and heartwarming testifying. So thank you, Madam Chair.
Thank you, Senator Cwodzinski. So we'll need to move your A1 amendment.
Please do.
And we're going to move that with a voice vote to adopt that amendment, but I'm wondering if anybody has any questions on that. Oh, excuse me, A8 amendment. All right, seeing no questions or discussion on adopting the A8 amendment, all those in favor say aye. Aye. Those opposed? The A8 amendment is adopted. So now that it is before us as amended, Senator Cwodzinski, you've already more or less introduced your bill. Would you like to move right on to the testifiers?
Yes, please, Madam Chair.
Perfect. All right. Joining us this morning is Elif Ozturk. And I see that she's there at the testifying table. Ms. Ozturk, would you please state your full name for the record, and you may begin your testimony.
Thank you, Madam Chair and members of the committee, for giving me this opportunity to speak today. My name is Elif Ozturk, and I'm a junior at Hopkins High School. The first time that I truly became aware of the toll that a period takes on a young girl in school was during my 8th grade. Each and every day that I went to the girls' bathroom, I would hear whispers asking friends for products. I could feel the heightened stress caused by that time of the month. But what truly frustrated me was the fact that I had friends who didn't just forget their products, but couldn't afford them in the first place. I had friends whose parents couldn't give them access to this luxury product. I had friends who decided to just skip school during that time because we cannot learn when we are leaking. I thought to myself, how is this fair? How do we expect our students to carry this burden on them throughout the school day and still perform well? My #1 priority should be to learn, not to find a pad, so I could no longer be complacent with this injustice. During the fall of my 9th grade, I emailed various representatives, hoping they too would see my perspective on this. I received an excited response from Representative Feist and began working with her and Senator Cwodzinski. This is a low-cost effort that would help so many lives from having to miss out on their right to an education. Lives like mine, lives like your children, and lives like your grandchildren. Tampons and pads aren't optional. They are necessities. They hold the same purpose as toilet paper, which is always free for use. Yet these products are not so readily available within the walls of our schools. Why is that when they make the difference between a normal day and a traumatic one? Period poverty in schools is not new. This ongoing issue will never end in Minnesota without your assistance. Period poverty within schools is impeding on our students' educations and the right to be respected as human beings. It's time to finally provide this one product that will allow us to peacefully go through the school day. Thank you so much.
Thank you, Ms. Ozturk. Next, we have Rory Robarge to testify. If you would please state your full name for the record, and you may begin.
Thank you, Chair and members of the committee. My name is Tori Robarge. When I was a student at Egan High School, I was involved in a group of students that began to uncover the realities of period poverty in our district. As a part of our research, we wrote and administered a menstruation-based survey to our student body. We found overwhelming support for the addition of free products. When asked if there had ever been a time when they didn't have access to a product, 195 students offered us answers. 66% said that they didn't want to miss class by going to the nurse's office. 35% said that their teacher would not let them go. 18% said that they did not have the money to give to the nurse, who was paying out of pocket for the products. And 43% said they were too scared or embarrassed to ask the nurse for one personally. Almost 1 in 10 Americans have missed school due to a lack of period products. Hundreds of thousands of people are missing out on critical opportunities like an equal, well-deserved education. We expect that providing accessible products will increase attendance. People that don't regularly have access to these products at home don't have to be fearful of being unclean or insecure about a lack of hygiene that's out of their control. By providing these products inside of the bathrooms instead of the nurse's office, we are not only keeping students in the building, we are keeping them in their seats. In addition to the positive effects that these products will have on attendance, we would also be promoting inclusivity and open-mindedness in our schools. The fact that most menstrual products currently live in a nurse's office is unacceptable. Not all students that menstruate identify as female. While this may not be an acceptable truth to all, it is a reality. Keeping products in a private space such as the bathroom provides relief for those that don't feel comfortable or safe walking through the school with their products. By providing these products in bathrooms throughout the building, we are actively fostering open-mindedness and understanding in our students and our future leaders. We are reinforcing the fact that these products keep us healthy and clean, and that they are not something to be hidden in a drawer, in an office, at a cost. Period poverty is not a political issue. Period poverty is not a way to impose power over school districts or to question their ability to make their own decisions. Period poverty is a health issue and it is an equity issue. Once more, I am urging you to understand the fact that the students of this state will be immeasurably grateful for the decision that you've made with them in mind. While student advocacy is an incredibly vital part of the education system, it should be noted that every single kid in our school should have the same ultimate goal: to learn. What is it that we're teaching these menstruating students when we deny them the right to accessible and necessary hygiene tools? Do they learn that their non-menstruating counterparts have the ability to focus solely on the present, never wondering how the state of the restroom could affect the rest of their day? Do we teach them that fighting tirelessly for their own emotional and physical well-being is a great chance to practice their public speaking, or it's an amazing resume builder? Or do we show them that at the end of the day, there will always be another obstacle in the way to their path for an equitable education? These students will be grateful not only for the access to products, not only for the chance to maintain an equal education with their peers, but also for the work that is being done to normalize an uncontrollable bodily function. They will take a moment to breathe because that's one less thing they need to worry about in the storm of madness that is adolescence. Period poverty is not something that can be disagreed with. Period poverty is indisputable and your students need you.
Thank you so much, Ms. Rabarge. Next, we have Evelyn Gore. Is she here? Or is she online? There she is. Ms. Gore, would you please state your name, your full name for the record, and you may begin your testimony.
Hi, thank you, Madam Chair and committee members. My name is Evelyn Gore, and I graduated last year from Egan High School. I am lucky enough to be Zooming to you from a state that requires free menstrual products in all school bathrooms. I was not so lucky to grow up in a state that did. As one of the leaders who worked to end period poverty in District 196, this initiative actually started out through an Honors 10 speech class. We were given the task to present a group speech about a topic that we are passionate about. In an all-female group, we found common ground with the issue of period poverty. As we spent more time researching, our passion grew. Within minutes, we were emailing our superintendent, Mary Kraker, and inviting her to come and watch our class presentation. After partnering up with our Women's Empowerment Club, speaking at several school board meetings, and surveying our own school body, District 196 awarded us with a $10,000 grant. This grant tangibly allowed us to actually make a difference. Today, in District 196, you can find free tampons and pads in the gender-neutral women's and at least one men's bathroom for every school. While our story is seen as a success story, this equity needs to be brought to the rest of the students of Minnesota. It's not fair to assume that other districts can do what District 196 has done. My district is very fortunate to have the resources that other areas of the state do not have. And frankly, even if that wasn't the case, this shouldn't have been something that I even had to do. Although I am glad we started this period poverty project, I am so thankful for all of our supporters. But as a teenager in high school, this isn't something that I should have had to fight for in the first place. And that is why this district mandate is so important. When I first started this project, I was 15 years old. As a 15-year-old, I shouldn't have had to worry about solving period poverty. As a 15-year-old, I should be worried about my chemistry exam on Thursday, or whether or not my friends were in the same lunch as me, not whether or not the world around me cared enough about students like me to provide these basic human needs. So I ask you to use my period poverty project not as an example for what other districts should do, but instead as an example of how providing free menstrual products for students is crucial in creating the safe learning environment that we so often claim to create. Thank you.
Thank you so much, Ms. Score, for zooming in with us and sharing your message. Next, we have Merritt Matson. I believe she's coming in remotely. Is she there? There she is. Ms. Matson, would you please state your full name for the record, and you may begin your testimony.
Thank you, Madam Chair and committee members. My name is Mara Matson, and I'm 14 years old. I'm a student at Mankato East High School, and I present this statement in support of HF 50, which aims to provide free menstrual products to Minnesota school bathrooms. Providing free period products would remove unnecessary stress from students' everyday lives. Every menstruating individual knows what it's like to be caught off guard without the supplies you need, but this does not need to be the reality in our schools. We can provide students with the period products they need for a safer, more equitable learning experience. Nobody deserves to worry whether or not they will have access to or be able to afford basic hygiene products while they're at school. Right now, it's up to students to help provide for themselves and each other. I'm currently working with a group of other students to plan a period product drive across my district to make sure that every student has access to the products they need, no matter their financial standing. I'm fortunate enough that this has not been an issue for me, but many people are not, and access to period products should never be based on the good fortunes of students. Thank you.
Thank you so much for your words and your support, Ms. Matson. Next, we have Driana, Alexis, and Chloe, who are here from Girl Scout Troop number 34640. They will testify together. When you do speak, would you please remember to state your full name for the record, and then whoever is going to begin may begin.
Good morning, Madam Chair, members of the committee. I am Chloe Henderson from Girl Scout 34630. Thank you for allowing us to come in and testify on this really important social issue. We were invited here today because we recently completed our Silver Award project as a response to a need in our schools. We identified that girls don't have access to feminine hygiene products, so we installed a hygiene closet that provides students with basic hygiene and menstruation products. We identified that girls don't have discrete ways to access these products, so we also supplied the school with a girls' bathroom pass for each classroom that has feminine products in it, so the girls will have immediate access to products when they need them. This idea worked really great for the small school we worked with, but not for every school. We need a solution for every school. Thank you.
Driana Schultz.
And the next, remember to say your full name and then begin.
Driana Schultz, Troop 34630. During research for this project, we learned a lot of how lack of access to feminine hygiene products affects girls of all ages. We all personally know girls that have missed school due to not having products. We were also shocked about how long it takes to get products at school. For example, leaving class to go to the bathroom and return to class takes about 3 minutes in our small school. However, if a girl goes to the bathroom and realizes she needs a pad or tampon, she will need to go to her locker. If she has no products in her locker, she will have to go to the office, then back to the bathroom, and finally back to class. Our classes are about 50 minutes long. We timed how long this incident would take, and it took 10 minutes. That's 20% of our class time. Products need to be not only available to girls, but they need to be in the bathroom. Again, our school is small, but in larger schools, this trip to simply get an essential need product for a body function that is out of our control could take as much as half the class period. This is unacceptable and must change.
I'm Alexis Grings from Troop 34630. Our school may be small, but we have a variety of backgrounds that all students come from. Imagine not being able to afford toilet paper, water, food, heat, or any other essential needs. Feminine hygiene products are not a luxury. They are a basic need. We all know there are girls who can't afford to eat, let alone find money to buy period products. Periods are not fun in general, but not having supplies causes undue stress for girls that need to focus on learning. Please help focus girls' learning.
Thank you so much. Next, we have another set of Girl Scouts from Troop 27238, Addison and Ellie. Would you like to join us? If you would please state your full name for the record, and then you may begin.
I am Ellie Schultz from Girl Scout Troop 27238. We are currently working on our silver award, which is installing feminine hygiene cabinets in the bathrooms of our upper elementary school. We identified the need to have supplies available for younger girls when we completed our Take Action project. We provided every fourth grader with a hygiene pack. We gave each boy deodorant and each girl deodorant and feminine products. Girls in fourth grade are ages 9 to 10. They are young and having to deal with getting their period. Girls this age face unique challenges around privacy and access to products. Elementary schools are not set up for girls to discreetly access products. They have lockers that don't lock or shared lockers in coat rooms. Peers do not always understand what products are, and this can result in teasing or bullying. If products are located in the bathroom, this would help tremendously with not only having access to products, but it would also help ease the stigma about having a period at a young age.
Thank you so much. And our next testifier? Remember to state your full name.
Hello, I'm Addison Henderson from Troop 27238, and we are all from Belle Plaine. This committee has heard a lot of testimonies in regards to this proposal. We have seen firsthand how period poverty affects our sisters, our friends, and our classmates. Women have been having periods for all of time. It's sad that this is identified as an issue when it is reality for so many girls. Girls get periods and need products for this uncontrollable thing that happens to them every month. If we have the ability to take this burden off young girls so they can just focus on learning, why is this up for debate? Please consider all girls when making your decision about this bill. Think about your mothers, your sisters, your daughters, and your 14-year-old self. Look at our faces and tell us we don't deserve to have one less thing to worry about. Thank you for your time.
Thank you so much for your testimony. Do you have any other testifiers, Senator Cwodzinski?
I do not that I'm aware of.
All right. Members, are there any questions? Senator Lucera.
Thank you, Madam Chair, and to the bill's chief author. So I was melding together the original bill and the amendment, and I think the definition stays the same here, that menstrual products means, and I'm reading from the amendment here, pads, tampons, and other similar products used in connection with the menstrual cycle. And I then also see that the products must be available to all menstruating students. Then when I look at the underlying bill, which was not modified by the amendment, I'm reading on line 2.8 and 2.10, part of the cost basis for the funding mechanism for the schools is going to be based upon adjusted pupil units. And again, that's on both lines. So my question, Madam Chair, is this being based on all students in the population, or is it based on those that are students in connection with the menstrual cycle?
Senator Cwodzinski.
Thank you for that question, Senator. I'm going to let Ms. Hofer answer that question if she's willing.
Ms. Hofer?
Thank you, Madam Chair. Senator Lucero, to your question, the adjusted pupil units described in the bill on line 2.8 refers to all adjusted pupil units within a school district.
Follow-up, Senator Lucero?
Thank you, Madam Chair, and I do have several questions, several follow-ups. So just to confirm that I understand, so that the funding will also include male students?
Ms. Hoffner?
Thank you, Madam Chair and Senator Lucero. So the adjusted pupil units would be for all students regardless of gender.
Senator Lucero?
Thank you, Madam Chair, and then to the bill author. Based on that, and because boys are not associated and don't experience the menstrual cycle, would you, as the bill's chief author, be willing to accept an amendment that would clarify that the funding on line 2.8 and 2.10 is not based on the entire student population, but instead based on girls? Those are the only ones that experience the menstrual cycle.
Senator Cwodzinski?
No, I don't think so. I think the bill's pretty clear, Senator. Already.
Response?
Thank you, Madam Chair. Okay, so you would not accept to clarify that the funding would be based on only those that experience the menstrual cycle. Well, then I guess that might lead into the next question, which is on the amendment on line 1.5, it says the products must be made available in restrooms regularly used by students. Because girl and boy restrooms is not specified, my question, Madam Chair, for the chief author, is it your intention that the menstrual products be made available in the boys' restrooms as well, again, as a result of lack of clarity in the language?
Yeah.
Senator Cwodzinski?
Thank you, Madam Chair. The amendment was from the Minnesota Association of School Districts. So they believed that this language leaves it open for local control. So I think some are making this a boys versus girls issue when all we're trying to do is help students that are menstruating in our schools not have to go through all the trauma that we've just listened to and all the things that go with being a young person in our schools. And we're just trying to help them. And the $2 million, $1.9 million is going to help a lot of students not miss class.
Senator Lucero, follow-up?
Thank you, Madam Chair. Okay, well, I very much am appreciative and also a supporter of local control, but as I read the language, as written here, it says must be available to all menstruating students in restrooms. It doesn't specify which restrooms. And so, according to your response there, is it your understanding as the bill's chief author that the menstruating students, and then because restrooms isn't specified, that you are seeking, it's your objective that these products be made available in only female restrooms?
I think it needs to be available to anybody that is menstruating. It's just that simple. I mean, I don't know what you're asking. So it's students who are menstruating will be provided with products that will not lead them to suffer from trauma and missing classes and needing a quarter and all the things we've heard today. So maybe we're not on the same wavelength on our analysis of that word.
Could we, I see that Mr. Kroonquist is willing to step up and maybe respond to this and get some clarification. Mr. Kroonquist, if you'd like to join them at the testimony table. State your full name and you may begin.
Thank you, Madam Chair and members. And yeah, Representative Lucero, we do think that the amendment offers the flexibility that you're talking about, that in the language around according to a plan developed by the school district. So the school district will ensure that products are available to all menstruating students. We believe that's pretty clear. And then the second issue around the funding, that's just the adjusted pupil units is just what's going to generate the funding for the school districts to ensure that this is not an unfunded mandate.
Follow-up, Senator Lucero.
Thank you, Madam Chair. A couple things. First, the funding being based upon all boys and girls. Boys don't menstruate, and they're not associated with the menstrual cycle. So therefore, I don't think that it is a good use of taxpayer dollars to base a funding mechanism on those that are not menstruating. It appears that there might be disagreement on that, clearly, with the chief author's response. Second, I disagree with the assertion that this allows for flexibility, because on line 1.5, the word must is there. The products must be available. That's not local control, that's not flexibility, that is a directive from the state. 3, the bill author had mentioned that made available to all those that are menstruating. My question is focusing on the boys' bathroom. Madam Chair, to the bill author, do you believe that there are those that are menstruating that would be in the boys' bathroom?
Senator Cwodzinski.
Again, as Mr. Kronquist said, it's up to local control. If they have students that have that need, then they will meet that need. And with your comments about the word must, I have, with all due respect, Senator, that's what these girls are begging for. These young women are saying, you must provide these for us. And so I don't know what else we can do up here, and other than we need to listen to what these 50% of the population is begging for, and to say to our school districts who have come on board with this bill because of the amendment we offered, that the word must is what they're demanding. And so I don't know if you would prefer may or shall, but I'm going to stick with the word must, because they've been telling us this for far too long. I wish this would have been dealt with Title IX in 1972, and this wasn't even an issue today. But nonetheless, we failed our students for the last 51 years, and now it's time to get things right.
Follow-up, Senator.
Thank you, Madam Chair, and I'll just finish with this, not another question. But the word must is referring to the restrooms. They must be provided in all restrooms. And you, as the bill author, Madam Chair, the bill author has made it clear he's not interested in focusing on those that actually experience the menstrual cycle. And I'm concerned of the lack of clarity in this bill. So again, I'm drawing attention to the word must and the association with putting these products in boys' restrooms. So, Madam Chair, I detect attempting to skirt around what my questions are. The reality is, taxpayers should not be required across the state to provide products in restrooms that are used by boys that don't experience the menstrual cycle. Thank you, Madam Chair.
Thank you, Mr. Lucero, or Senator Lucero. Senator Westland.
Madam Chair, could one of the testifiers would like to add something?
Oh, go ahead.
Hi, thank you. My name is Tori Robarge, and I can understand why there might be some confusion about why myself and my peers have asked that these products be put in all bathrooms throughout the school building. But as we were talking about mental health earlier and PTSD, I think it's very important to bring up the fact that I have friends and I have peers that do not identify as female, but also menstruate. And while this is something that is not seen as a societal norm, it is something that happens. And I do have friends that have very difficult home lives because of the way that they identify. And I have friends that have struggled socially because they are not seen as what's normal. And I think that by providing these products in all bathrooms, we are actively focusing on all students instead of one side or the other. And I think that it is imperative to our students' mental health and their physical health that they are given access to these products regardless of where they fit into the norms of our society. I don't think that it makes... I think that it does make sense to keep these products in all restrooms throughout the schools, because even though we ourselves might not understand why someone else would live it the way they would, it is something that happens, and it is something that we need to take in consideration when we are saying that we are working for all students in the state.
Thank you so much for that. Senator Westland.
Thank you, Madam Chair. And maybe Ms. Hofer could address this. If we are going to go through and take a census of every person that menstruates every single year in order to come up with a funding mechanism, would that not create a greater burden on school districts? That number is going to change every year, I assume.
Ms. Hoffman.
Madam Chair, Senator Westland, thank you for the question. You are correct that the Department of Education does not currently have a code that would differentiate between the adjusted pupil units that are menstruating and those that are not.
Madam Chair, and just as a follow-up, and Ms. Hofer, you can probably answer this question as well. Are there other things that we fund, other capital investments, other things that we fund based on that particular formula for things that not every student benefits from? So for instance, if we have assistive technology, that is not benefiting every student, but isn't that also calculated in the same way?
Ms. Hofer.
Madam Chair, Senator Westland, thank you for the question. Yes, that is correct. So adjusted pupil units is the pupil count that is used for operating capital revenue, and that would include so that's how the funding is calculated, but you're correct that the uses wouldn't necessarily all be for the same students.
Thank you, Madam Chair, or thank you, Ms.
Follow
Hubbard.
up.
And just one final comment. I'm exercising my edit function for a minute. This committee and these bills are being heard because we have students who are in need, and they should not be used for the purpose of adding greater burden or shame on students who may be a little bit different. And I think adults should show a little more restraint and compassion. We do have students, as was just so brilliantly commented on by our testifier, we have students who identify, trans students who identify as male who menstruate. And the purpose here is to avoid shaming students who need a simple product to get through their day. And that is what we should be focusing on. And the last thing I will say is I'm going to assume that there are some schools that have gender-neutral bathrooms and not necessarily bathrooms that are specifically identified for male students and some for female students. By saying these should go into bathrooms, we address the fact that each local unit is going to be a little bit different, and we are allowing them to make the decision as to where these products should go. But I think that this line of questioning and this absolutely needs to stop.
Senator Bayquade.
Thank you, Madam Chair, and I want to thank Senator Westland for just taking a little bit of time for my edit function to go through as well. And I don't know if I could say it any better than you said it, so I really appreciate it. It must be really hard to come and sit in front of a bunch of adults who've been elected who might say disparaging things about the LGBTQ community, of which I'm part of. And 11.5% of students in our schools identify as a sex other than the one they were assigned at birth. So whether we acknowledge it or agree with it or understand it, that is what we have in our schools. And our schools know that, educators know that, our school boards know that, our school districts know that. My district, School District 196, has gender-neutral bathrooms, is one of the school districts that has products in the bathroom. And so, you know, this bill doesn't say all menstruating students in all restrooms. It says products must be available to all menstruating students in restrooms, whichever restrooms those may be. But like Senator Westland said, it is really important that we do not use the power and the bully pulpit of this committee to disparage LGBTQ students, particularly trans students, non-binary students, gender-expansive students. They are a growing population in our state, and they experience some of the highest rates of mental health crises because of things like this. Because when adults in power use that power to bully children, it feels bad. And it shows up in our schools. And we just had a whole hearing about mental health and the counselors needing more counselors in schools. This is part of why. And so maybe I didn't edit very well, but there are people who identify as boys who menstruate. There are people who use boys' bathrooms that menstruate, whether we like it or not, whether we agree with it or not. I don't care because I just use the bathroom to pee, and so do they. So we should just let these students have the menstruating products that they need so that they can get through their day and not have to come to this committee anymore and ask us for tampons. Thank you.
Senator Cruin, you had a question or a comment?
Thank you, Madam Chair. It seemed like there was a little crosstalk between the exchange with Senator Lucero and the chief author, and maybe the question is for the chief author or Mr. Kroonquist, or both. But my focus is I want to bring it back to the language of the bill here and the amendment, the A8 amendment, and the word according to a plan developed by the school district. I want to kind of bring us back to that language. And Mr. Kroonquist testified that it's his belief that that gives local school districts flexibility in how they want to administer that. I believe, I don't want to put words in your mouth, but I believe that was the crux of your testimony. So I guess my question is, let's say a local school district, in putting this plan together that's required by the A8 amendment, decided to just put these products in girls' bathrooms and say gender-neutral bathrooms, would they be in compliance with the law?
Senator Cwodzinski.
Yeah, that's a good question. I believe so, yes. Mr. Kroonquist, you want to weigh in or counsel? Ms. Lewis?
Welcome back, Mr. Kroonquist. Please state your name for the record, and you may begin.
Madam Chair, Scott Cronquist with the Association of Metropolitan School Districts. That would be my reading as well, but I would defer to Ms. Lewis, who actually has a law degree, and I don't.
Ms. Lewis.
Madam Chair, members, I'm not sure the law degree allows me this, but if you see on the amendment, the AA, on 1.6 and 1.7, the products are placed according to a plan developed by the school district. So if that's their plan, then it would be in compliance with this language.
Thank you. Follow up?
Thank you. I mean, it seems like that's the kind of local control we're looking for. I question whether or not this language actually gets us to that, and I'm heartened that we're having this conversation in the committee, and perhaps that could be used as legislative history at some point down the road, although I don't think the actual wording in this accomplishes what the intention of the chief author and Mr. Kroonquist and legal counsel says. At least there's a question. I'm not saying it doesn't. It seems to me that this could be written better to make that point specifically and explicitly clear. And then we could have bipartisan approach to this, and everybody could get on the same page. We could be building trust rather than creating wedge issues and bringing partisanship into something that I think many people sympathize and understand with the basics of this bill. I think one potential amendment that maybe you might be open to that could put this to rest would be to insert the word female before students in lines 1.6. I think that would make that clear, and so any restroom that's regularly used by females would be covered under the must. And I'm just wondering, I'm not making that amendment, I'm just wondering what your thoughts are about that.
I'd be opposed to that idea under the current situation, but I appreciate the question. It is very operable.
Senator Cruin.
Oh, thank you, Madam Chair. I guess then I'm wondering what the opposition would be if the intention were to allow local, or maybe we could go a different way and specifically put in the plan that the school districts are proposing that they have that flexibility, and we could just, would you be opposed to that type of an amendment?
Can you refer to the line and what the actual language you'd like to see inserted?
Senator Cruin.
Well, I don't have anything drafted, but it could say after, according to a plan developed by a school district, we could add, and an acceptable plan would be to place these products in restrooms regularly used by female students.
Yeah,
Senator Cwodzinski.
Sorry, Madam Chair. I think the language is pretty self-explanatory on what the needs are of the student. So again, I'd be hesitant in using the word female in this bill.
Thank you. Follow up?
Okay, well, I mean, trying to come to some sort of consensus here that could get us to bipartisan support of this bill. I do really I would hope there could be local control, and I hope that the language in this bill accomplishes what the chief author says it does, which is that a school district does have the flexibility to limit this mandate and to girls' bathrooms if that's what they so choose to do. I hope this accomplishes it. I have my doubts about the way it's drafted, but I guess I'll just leave it at that. Thank you.
Thank you. Senator Rarick, you had a comment or question?
Thank you, Madam Chair. And a lot of it's along the same line, wanting that comfort that the local control is going to be there to develop that plan. I believe it was Ms. Gore who said her school district made that plan. And I want to, I guess, would make sure that that plan would be compliant with what we put in place, because it sounds like they got very involved, addressed the issue, and came up with something that was satisfactory to the students. Because another reality that's out there, if we put these in every restroom, we have a number of adolescents who would probably take those out of the restroom and use them to make fun of other people, things like that. So I think having that ability at the local school district to be able to develop those plans so that there's still that ability to put them where they feel it will be of best use for those who need them without creating other issues, I think is something we want to maintain. With that as well, knowing how far behind our students are because of the last couple of years, I am going to be struggling with any new mandates on our schools. But I'm pretty sure this is moving forward, so I just want to make sure it is, as being discussed, that the local school boards and parents have a way to put it in a way that works for their schools. Thank you.
Thank you, Senator Rarick. Senator Umu Verbaden, you had a comment, question?
Yeah, just a comment, Madam Chair. I think that this language is very clear in stating menstruating students, and I thank you for your work on this, Senator Cwodzinski. And also from Ms. Robarge, I think you just explained this very clearly for the committee. This is, I can't imagine not providing toilet paper or soap. These are things that our students need. It's the right thing to do. It's $2 per student. Let's get it done.
Thank you, Senator. Senator Gustafson.
Just a brief comment. I heard a lot of, talk about consensus, and I agree that usually is the best way forward, but I also want to remind people, and Senator Cwodzinski, does this bill have bipartisan support? Senator Cwodzinski.
It does.
All right. I just wanted to make sure that we were clear on that there is bipartisan support for this. It is, it is a need. I know that some of the language that we've heard today is very inflammatory, but I do want to say thank you to the senators who had some thoughtful and measured comments, and I appreciate that. So thank you, Madam Chair.
Thank you. Senator Cwodzinski.
Can one of the testifiers say some comments?
Yes, I'd love to hear some more comments.
Hi, thank you.
Please state your name again.
My name is Tori Robarge. I was part of the school project for Egan High School. We were very privileged in the fact that we were able to reach out to a foundation that would provide us with a grant, which is something that not many people are able to do, and not many people have the access to the resources that allowed us to do that. And like Evelyn said, we are very much so a success story and not the norm. And I just wanted to address the comment that you made, Senator Rarick, about vandalism. We began that project in my sophomore year of high school. I am now a freshman in college, and we rolled it out very quickly after we started. And in the years that we've implemented this, we have not had a single issue of vandalism. My little sister still goes to that school, and she receives comments every day in the hallways about the project. She tells me about them when she gets home from school, and she tells me that I have made the lives of her friends better, and she tells me that her friends are less stressed. And to be able to see that years down the line is something that makes me feel so warm and accomplished inside, because I know that we have been able to impact the lives of the students. If anything, we have increased morale. We have benefited these students' mental health, because that is one less thing they have to worry about. And just once more, we haven't seen a single issue of vandalism in our bathrooms. These boxes have been up on the wall for years. We have posters talking about how to properly use the products, and they have not been ripped down or written on. The students are grateful for the knowledge that they haven't necessarily been given in their sexual education classes, and they are grateful for the access to the products. If students are taking them, it's because they need them. If students are taking a couple extra on Friday, it's because they don't have them at home. It's not about stealing products. It's not about using them as a tactic to bully other people. The students are taking the products when they need them because they need them. Thank you.
Thank you. It certainly does provide an opportunity for conversation and certainly teachable moments about respecting property of our schools, as well as acknowledging the uniqueness of situations. I think there was somebody online that wanted to make a comment. Evelyn Gore, were you there? You wanted to say something?
Yeah, I just wanted to add, like Tori said, our school was very lucky to have the resources that we did to allow for this project to become a success story. Many other schools aren't allowed to do that and don't have those resources. And I get the whole need for local control, but by making this a government mandate, we are showing students across the state that we care about them, and that these needs are just as important as needs for like toilet paper or soap in the bathrooms. And I also would like to add in to the discourse about adding the word specifically female to the bill. That is discluding so many students, and like a lot of you have already said, it's important that even if you can't understand, and even if you'll never understand menstruation or the fact that trans kids are experiencing menstruation, it still happens, and it still is an issue that needs to be solved, regardless if you can understand or even respect. It's still an issue that needs to be solved, and these kids still need tampons and pads in bathrooms.
Thank you, Ms. Gore. Senator Lucero, you wanted to make another comment.
Thank you, Madam Chair, and I actually am going to offer an amendment, but before I do that, I just want to put on the record that I object to the characterization of comments that I made as disparaging in any regard, because my concern is taxpayer funding and making sure we're making wise decisions in accordance to biological reality. And biological reality is that only females experience the menstrual cycle. And attempting to clarify that in the language is in no way disparaging. I heard some comments here in regards to compassion. It's in my opinion, in regards to the previous bill that we heard, mental health, we had a very constructive conversation. And there are many children out there that are experiencing mental health, that may be confused, challenged in areas of their life, not have access to certain services. But the ultimate act of compassion for a student that is experiencing a mental health challenge is not to reinforce something that isn't true in accordance to biological facts, but instead to provide them the services and to help them That is the way to provide compassion. To my amendment, Madam Chair. On the amendment that was already adopted, on line 1.5, beginning with the sentence, "the products," my amendment would be to strike from that point down through the remaining of that sentence, which ends on 1.7 with the word "district," and to insert the following sentence. The products must be available to students in grades 4 through 12 in restrooms according to a plan developed by the school district. And Madam Chair, I would like to ask for a roll call that's recorded.
Okay. Senator Lucero, thank you. Senator Cwodzinski, are you understanding the amendment?
No, if you could go through it again, because I was trying to follow it. Thank you,
Senator
Senator.
Lucero.
Sure. So thank you, Madam Chair. So working off of the amendment that was already adopted, on line 1.5, there is a sentence that begins with the words, "the products." So beginning right there, running through that sentence, which concludes on line 1.7 with the word "district," period. So striking that entire sentence and substituting that sentence with the following. The products must be available to students in grades 4 to 12 in restrooms according to a plan developed by the school district.
Senator Cwodzinski, response to that.
Yeah, I like the original language, Senator.
Senator Lucero.
I have no further comments, Madam Chair, just that I'm looking for a roll call vote and it to be recorded.
Okay. A roll call has, Senator Cruin.
Can I have you repeat the inclusion of that sentence and go really slow, please? Thank you.
Senator Lucero.
Sure, I'll read it again and nice and slow. The products must be available to students in grades 4 to 12 in restrooms according to a plan developed by the school district.
Thank you, Senator Lucero. Ms. Lewis, would you please state that full amendment before we take the roll call vote?
Absolutely, Madam Chair. Madam Chair, members, line 1.5 to say 1.7, delete the sentence and insert, the products must be available to students in grades 4 to 12 in restrooms according to a plan developed by the school district.
Is that your amendment, Senator Lucero?
Spot on. Thank you, Madam Chair.
Thank you. Then we will take that vote right now, and our assistant, Sami Rajab, will take that vote, do the roll call for the vote.
Senator Gustafson?
No.
Senator Rarick?
Yes.
Senator Cwodzinski?
No.
Senator Farnsworth?
Yes.
Senator Cruin?
Yes.
Senator Lucero?
Yes.
Senator May-Quade?
No.
Senator Umu Verbaden?
No.
Senator Westland?
No.
Chair Kunish?
No. What is it? 6-4. With a vote of 6 noes and 4 ayes, the motion does fail. So with that, Senator Cwodzinski, would you like to make any final comments?
No, the young students that spoke today so eloquently, I can't add or detract from their testimony. So, but thank you, Madam Chair, and thank you for the spirited discussion. It's an important issue, and I'd like to see this get done, so thank you.
Okay, would you like to renew your motion to move this, pass this on to finance?
Yes.
Thank you. All right, with that, members, we are adjourned. We do need to, I do need to have a vote here. So let's all sit down one more second and re-adjourn. And we will have to have a vote to move this on to finance. Is that correct? Okay. So we'll do a quick voice vote. All in favor of moving this vote on to finance, please say aye.
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 Madam Chair, what bill are we moving forward?
We are moving forward Senate File 50.
Okay, just making sure the proper motion.
Thank you. Senate, all of those nays to moving Senate File 50 on to finance, please state your vote. All those who say, oh my gosh, all those who vote nay. No. All right. The yeas have it. This bill will move on to Senate, to the Finance Committee. Thank you, and we are re-adjourned.